Hey there. Welcome to the Pelvis Project podcast. I'm Megan.
And I'm Roxy. We're two pelvic health experts brought together by passion for our careers, entrepreneurship, motherhood, and the desire for intentional relationships.
Join us in our mission to spread pelvic floor awareness and start conversations surrounding the truth behind genuine health, imperfect wellness, and joyfully navigating life. We are so glad you are here with us.
Let's start the conversation. Hello, Megan. How are you?
Hi, good.
We are back. Let's hop right in. Tell me something good. What's been good on your plate?
Well, let's see. Tell me something good. The sun's out, weather's getting nice, but I finally finished the last step in the pelvic rehab fertility specialist certification. Yeah. So
congrats.
Thank you. So that's done. And it's never done. You just have the steps done. We're just always learning. So I'm super excited about that. And just what an honor to have the privilege to be part of that program. And everybody listening, Roxy's in it, has been in with me, and everybody's kind of gets their own. We have such a long window to be able to write up our patient study. And so it's been fun to do together and be able to practice on each other. That's how Roxy and I met in the first place, was at a course. But I think this one's just extra special for many reasons, and felt, I don't know, you probably feel the same way, Roxy. It's like it has felt like the most robust certification that I feel like I've done since starting in pelvic health, and having to take a test and write a case study. And I feel like all of us, when we took that test, felt like we were studying for the boards, which was just, I just had to chuckle at myself because we were so stressed about it. But you also want to honor, Dr. Yenny's just so great that you want to do well. And, we're her students, and we just want to represent well of what she has taught us. So anyway, it's been awesome, but that felt really good to get that done. What about you, Rox? Tell me something good.
Oh, I think I just spent most of the afternoon outside, and that was just food for the soul. It was nice. I had shorts on, actually. I normally don't do that, but I was out, cleaning a little garden plot, and I was sweating. So I went inside and put shorts on. But anyway, it was just good to move my body, be in the sun, be in the fresh air for more than just walking in and out of my car and, things like that. So
yeah, always good.
All righty. Well, we're going to talk about a topic tonight that has been coming up a lot for each of us clinically, but then just I think it's a good reminder as we get into a new season with new types of movements and activities. We're getting into the spring. There's going to be people doing more yard work, or maybe just getting outside more, or starting to golf again, or whatever it is that the new season brings, or maybe just, exercising or doing new workouts or whatever it is. So what we want to talk about is that there's no such thing as a bad exercise. We're going to expand on that. It's not just going to be exercise, but it's just going to be movements, things like that. And kind of chat about debunking some myths and some unnecessary fears that a lot of our patients are walking around with just simply because they don't know the facts or the truth, or they don't have the guidance for that. So hopefully this will help some people who maybe do have concerns about, I don't know if I should do this or that because it might be bad for my body, or it might make my symptoms worse, or any of the questions or fears or concerns along those same lines.
Yeah. And this question has come up before for us of, I think Roxy and I hear a lot of, should I avoid X? Should I avoid Y and Z? And to Roxy's point, there is no such thing to us as a bad exercise. It just depends on, how you're been taught to do it, how you're performing it. And we're here to help guide you through it so that you can optimize and do whatever it is you please, and make sure that it's safe for you. So I know, Roxy, you've had this come up here recently in the clinic. Why don't you tell us a little bit about what you've heard and seen?
Sure. So I've just had, for example, I've had a gal who's struggling with some prolapse, and she notices that she just feels more symptoms and has some more leakage. When she is bent over gardening or she's squatted or kneeling down, pulling weeds, lifting, all the gardening things. But she loves gardening, but she also wants to feel better. So we had this good conversation about, well, I know probably shouldn't do that, or I should just probably, I think that's probably why I have what I have and why it's worse. And I can tell it gets worse when I do that. So do you think like I should just try to stop or do less of that? But in the same breath, she's telling me that she absolutely loves doing that. It brings her
Mm-hmm.
joy.
Mm-hmm.
Like that is her satisfaction. And so as we're working through that, it's been really satisfying and really rewarding then because you can just see her eyes light up because she was in fact doing that movement incorrectly, unknowingly, unintentionally. Her body just wasn't doing that in a way that supported her and supported itself. So therefore she had symptoms, but that caused her then to believe that that hobby, that
Mm-hmm.
movement, that activity was harming her and making her symptoms worse. And so when we corrected, we took exactly what she's already doing. I said, I actually don't want you to change. I don't want you to not do that. Like, I want you to keep
Mm-hmm.
doing that actually. But let's teach your body to do it in a way that supports you and in a
Mm-hmm.
way that minimizes, if not eliminates, those symptoms. And then you can keep doing it and move forward. And so I think that there's been several themes. I know we've both experienced that, but lately that's just been a big one of like, oh, should I just stop? Is it just time in my life that I should just be done with that? Or should I just
Yeah.
find a new hobby? Or like just this really, I guess, compromised mentality that is very untrue. And then just the testimony of that, of just the joy and the hope and the excitement that she has shown because she realizes, oh, I don't have to fear this, or I don't have to feel guilty, or I don't have to cut it back on it.
Yeah. Yeah. I think that we have to be careful in the space of we hear these kind of talking in absolutes, like you should never do this. So then we start to question and yeah, like with your patient, all she knew is okay, my symptoms are a little bit worse. I probably just shouldn't do this. And it's a good thing that she's working with you to be able to not take away because then you when you take away things like that, then you're starting to talk about the influence of potentially like quality of life. We have to think about, I know when we were at Peloton just talking about all the different factors as far as that was exercise for her. She's getting vitamin D. It's helping her mental health. Like all of these factors that are really important when we're thinking about the whole person. And I know I have had some experience with, especially women who, and they're not even like necessarily newly postpartum. I'm thinking of one patient in particular that was fairly far along postpartum and had a little bit of a DR, a diastasis recti, and it wasn't bad, but it was present. And so this whole you should avoid crunches isn't necessarily true. And it all depends on how the rest of your body is moving and working. And we know now that we're more worried about are you producing tension through the DR versus how wide is it and that sort of thing. And so for her, we had been she had some other pelvic floor issues going on, and so we worked on clearing those up and worked on proper activation coordination between her pelvic floor and her core. She just learned her body better and then worked on some breath work. And the cool thing about that is then you can have somebody, at that point, I had her laying on her back on the table and um, hands up towards the ceiling with a yoga block to provide a little bit of pressure, like almost like if you'd use like a Pilates ring and legs out straight, and we did proper breath work, and she did basically like a full sit up from that position while I watched her core. And there's no coning, there's no doming, there's no sinking in. Like she did a great job. She did a great job. And I think that that's specifically to a population that there's just so many mixed thought processes behind. And I've also had a patient come in postpartum who had a DR. She was fresh. And she was like, I know I gave this to myself. I just XYZ. And I was I was like, whoa, 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 whoa. stop right there. No, that's not it. And I think when you just kind of retrain and then let people try these exercises that are quote unquote bad, and they're like, oh yeah, I can do this, and it's safe. And if there's a challenge piece of it, informed education, they know, and sometimes it's worth going after it still. So
Yeah. Well, and I think kind of like what you just talked about, just being, I think sometimes providers are too, how do I say this? Are the arbiter of their patient's health even.
yeah, yeah.
And I've just heard so many people say, well, I'm not supposed to lift more than 10 or 15 pounds, or I can't lift. The doctor told me not to. Or, even just like, I mean, there's just been a lot of things that I feel like have been precautions, and like some of them are well intentioned. And obviously, I'm not coming against any like post op or things like that. I'm just
Yeah.
saying in general, like people are told things like don't ever do this, or like Megan said, never do this. Always stay under this amount of weight, or don't squat too
Mhm.
low, or whatever it is. And I think at the end of the day, we can make these for whatever that recommendation was. It probably is a valid recommendation, but the problem is we're not taking the whole person into account when we say that. I always tell people, like, here's the deal: is I'm looking out for this part. I'm looking out for this part of your body. But if that's something that you love to do, and I said, really, at worst case scenario, you learn your body. Okay, I can do this. I can do this movement. I can do this activity. I can do this exercise up to this many reps, or up to this much weight, or I can run this far, before I have symptoms. And you start to learn, if you're doing things right, but there's still some compromise in your body. And let's say that it's not like you can just go forever and never have a symptom again. I just tell people, you decide, like, if that's worth it to you, if running 5 miles is worth it and that's what you want to do, and you're okay maybe having leakage in that fifth mile or whatever, you're an adult and you can make that choice for yourself. But like, if you're doing it as good as you can and as correct as you can, and you feel confident in your ability to do that, then no one else should be really telling you how to live your life. And that's kind of just a little
Yeah.
soapbox sometimes I get on, of like, I'm going to look out for your pelvic floor and this in your core. And I really think that this is probably not a good idea to do this. But if you're doing it correctly and you're okay with symptoms, then like, who am I to tell you to never do that again, or
Right.
never go beyond that threshold or whatever?
Yeah. Well, and I think everybody has to remember too that normally when we hear something that, oh, we shouldn't do this, often what can happen is we maybe a recommendation has been given to somebody specifically for a specific reason in their body, and then it's being translated into the general population. And so it's kind of one of those things. It's like, that's why you go get your body assessed, learn what is good for your body, because what is good for you is not good for your neighbor. Perfect example is, well, Roxy and I, for for instance, like there are just things in my autoimmune body that are not smart, but for Roxy, they'd be great. So I think it's just all you have to remember that it's very individualized. And so I think too, also the point is, as far as when we're talking about maybe a specific exercise, but also just movements, I think that I have been around where, there are certain body positions that I have had therapists teach that say, like, don't do this, don't move your spine that way. Don't, because that's going to cause your symptoms or whatnot. And our body is built to move into extension, into flexion. I'm talking the spine. It's meant to rotate. It's meant to move in all different directions. It's never a good idea to limit one of those. I mean, yes, if you have terrible spinal stenosis and it's very, very painful to, do a certain movement, that's another thing. But when you have a body that can move and is healthy, we need to be able to get the range of motion in all directions. And if we can't, then that's what we need to be looking at. So I think just going into exercise, and it's good to be aware, but when we are questioning or avoiding or have been told a hard stop on something, I think our point with this is just making sure that if that's been said to you, that you understand the reasoning why, and that whoever told you that understands why they've told you not to do that versus just applying what they've heard, from TikTok or social media to, well, we just shouldn't do that.
Yeah. Well, and I sometimes feel like there are seasons where those recommendations are wise.
Yeah.
Maybe like post-op or something, like I kind of talked about earlier. Yeah, like there's definitely things we got to do and protect our body as it's healing or whatnot, or postpartum. Like I'm not going to go say
Yeah.
let's go to the trampoline park at 2 weeks postpartum. Like that's a terrible idea. But down the road, like if you want to go do that with your kids, I 100% support that. And let's help your body
Hmm.
progress and get to a place where it can go to the trampoline park and not be a whole thing, but I think we have to realize timing too of there might be things that you want to do down the road. Right now they make symptoms worse, or they could cause more symptoms or more dysfunction. But as we train the body to just do that in a safe and healthy way, then jumping on a trampoline isn't harmful in and of itself. And so that progression is really wise too, to just consider like in one season that isn't good, but let's get to where we can do that and teach the body how to build up to that spot.
Yeah, exactly. So I think that kind of a good place to kind of go with this is if we think about like the postpartum mom who's come in and we typically, I mean, Roxy and I love to see moms 2 to 3 weeks postpartum if we can, and we don't do any internal work at that point, but it's important to get in and get connected again with the pelvic floor. Make sure you're looking at any sort of aches or pains anywhere. Your body's just been through a lot. It's kind of the same thing as if you had knee surgery. You would always start your PT like, I mean, gosh, they start your therapy like a week later, if not that, a couple days later. So 2 to 3 weeks is not asking for too much. And so, you have that visit. And then, historically, everybody says they go for their 6-week visit postpartum to their OBGYN and they get the all clear. And they're like, you can go back to exercise. And I think that's where a good conversation about, okay, so what does that mean? Because you can just be released to go back to exercise, but you just went through an event. And that's where our role of coming in and seeing a public health therapist or women's health specialist that deals with the just honestly, like any, postpartum pregnancy, there's a series of things that we want to look at to make sure that you are safe going back. And in that case, it's like, yeah, again, there's no bad exercise there. But if if you're not able to coordinate, let's say even finding your core after you've had a baby because those muscles have been stretched out, if you can't even find those, but you're going to go run, that's where you can start to have an injury happen because those muscles just they haven't been rehabbed. You haven't been able to find them. The running's not wrong. It's just we want to make sure that we are again providing you with the education, the knowledge that you need in order to be successful with that. And that's the piece that's missing a lot that we see happen is you're being told something, but the education piece behind it is not there. You always want to try to make, the best decision with the information that you've been given. But if we're not given any good information, then it's really hard to make a decision that's good for our bodies. So I don't know, Roxy, if you have any other thoughts about that, but I just feel like that's something that I think needs to be mentioned is if we're tying this, if we're kind of even pulling in kind of that postpartum period of going to your 6-week follow-up and just being released to go do everything. But the education piece there, they're not also telling them like, well, hey, everything looks good and you're healing well. Now let's go start rehab so that you can return to everything that you've been, any sport activity or whatever it is you want to refer to as sport.
Yeah. No, I agree with all that. I think what I was thinking about as you were talking is If you don't feel confident, because like you were talking about that education, if you haven't been educated or you don't know or no one's told you, then you don't have the confidence going into that movement or activity or whatever. I think there's a section of people that maybe haven't been told not to do something or,
Yeah.
that it's not that there's been a warning, but when our body senses failure slash dysfunction, and then there's a symptom or a feeling that comes along with that, then that starts to ingrain in our body that something's wrong and this is a bad movement. And so I think that can go, we can even take it kind of a deeper step of then the body starts to have an aversion to certain movements. And it starts to make us even doubt ourselves more of like, oh, this isn't right or this is a bad thing, and
Hmm.
that internal dialogue in our head is telling us this movement's bad or this movement's unsafe, and when in fact, like Megan said, it's just that you're unaware of what is safe and what is correct, and that the movement itself isn't necessarily, or the task or the exercise or whatever it is that you're doing isn't unsafe. It's just that you're not confident. I think that's just a big thing. I think out of all of this, if we really dial in on, as pelvic therapists, some of our biggest goals are to not just do our skills on your body, but to give you the understanding and the empowerment to be able to go into your life and do this specific maybe exercise or activity that you're struggling with, but not to stop there, to be able to then to go into any new activity or any exercise or hobby or situation and say, oh, I haven't done this in years, or I've never done this, but that's no problem. I know how my body's supposed to work. So let's try this and see what happens. And I think just that empowerment piece of saying, the more that we can help you know your body,
Hmm.
the more confident you are to just go live and go do things that you love, or try new things, or challenge yourself, or be sporadic, or whatever it is. And I think that that's just so key in working with people who have had that fear or had that aversion to just different parts of life.
Yeah. Well, and I think this could even be said here too. I know the main piece of this is us talking about no exercise is bad. So I think it's important to remember too when we are talking about education and learning our bodies and how that's going to help us then to perform exercise better or know kind of like the why behind it or what's going on and knowing empowering that we can try things that are tough. We can push ourselves. That being said, when we have a problem going on, let's just say like you're leaking. And so you are going to get back into exercise and you're working out with somebody that is guiding you through that. I think that when it comes to especially what we do as pelvic floor providers, pelvic health, and physical therapists. So remember, at the end of the day, is from our standpoint too, we're PTs, but Roxy and I both work to find the root cause of the problem. And it's still kind of shocking to me that if someone's having urinary leaking, that they don't have an assessment done, or and it doesn't have to be urinary leaking, it could be anything. But it still is just surprising how we're not referred to by other healthcare providers, and they'll, either they blow it off or they just don't bring it up. And then B, they go to other wellness providers and it doesn't, there's no comment back about saying like, hey, I know I can help you, but I would really highly suggest you go get a pelvic floor assessment done first so we can really find out what's going on. Because to me, it's kind of like, I mean, if your car is leaking Freon and you know that there's something wrong and you go to the mechanic and they never lift the hood up to even look, it just seems like, well, now we're just going to start trying stuff and potentially it get worse, you know? And so I don't know, that's a terrible analogy, but I just think about like, why would we not just take one or two sessions to really figure out what's going on, get some proper education, some guidance, and that way you can really take off and thrive in whatever setting it is that you're choosing to do your, strengthening in. So I don't know if you have any thoughts about that, Roxy, but I just something recently that I'm kind of like, huh, well, that's interesting. We're skipping a really important part because that's the thing when what we see is a lot of times with a pelvic floor issue, it's not that the pelvic floor is necessarily weak. It's that it's can't lengthen correctly. And so therefore it can't work optimally. And if you don't have somebody there to assess that and help teach you how to lengthen properly, then if all you're doing is going and doing strengthening, and you're strengthening a muscle that's in a shortened position over and over, A, you're not going to strengthen it. And B, your symptoms are pretty much potentially could get worse. So it's just like, to me, it seems like, such a nowadays too, such more well known what we are doing and what we can do to help. So yeah, I don't know. Kind of went off on a segue there.
Okay, that's all right. It's good. So, moral of this whole story, of this whole podcast is don't be afraid to live life.
Yeah.
And if you're having a symptom, especially trunk, hip, pelvic floor, bowel, bladder, sexual, abdominal, anything around that area, pelvic floor therapy that's where you're going to find out what's actually going on. That's at the end of the day, like, we're going to be the ones that can look for that and can assess it and rule out or address the low-hanging fruit before a procedure or medication or whatever is offered to you. And that's going to help you live your best life moving forward anyway.
And then also, there's no wrong exercise. Whatever you want to try, we're going to be there to help support you through that and coach you through it and get your body strong. There's no bad exercise. There's no bad position that you need to not ever go into. There's just optimal ones, and there's some that are better than others, but it doesn't mean that we need to stop living our life and not doing what we love.
All right. Well, until next time, folks.
Thank you so much for joining us this week on the Pelvis Project podcast. Help us continue the conversation by liking and sharing this episode with friends. And if you really want to do us a solid, leave us a review. If you'd like to follow us on social, check out the show notes for links. And remember, this week, take a deep breath and relax your pelvic floor.